My name is Shane Mesko, and I'm a radiation oncologist. Radiation oncology is a constantly evolving field from the standpoint of technological advances. The machines have gotten more sophisticated. Our ability to track tumors and to monitor patients during treatment and before treatment has gotten more sophisticated. We're able to really shape the radiation field perfectly to even complex tumor shapes. And not only that, deliver the high doses to the tumor, but also spare more dose and carve it off of the areas of the body that we don't want radiation going to, which means higher cure rates and less side effects. The multidisciplinary approach at Scripps Cancer Center, I think, is a really innovative way of doing things, and I think it really benefits the patients. You basically take a patient who's coming in who needs to see maybe a surgeon, a radiation oncologist, a medical oncologist, and instead of having that fragmented where they're seeing them in different places over different periods of time, they can see us all together. We can meet in real time, come up with the best plan for them, discuss them in a tumor board, and then they know that they're getting the best option for them, and they know that we're all on the same page together. I'd like patients to know that I treat them exactly as I would treat someone in my own family or one of my best friends, and that's reflected across my entire team at the Cancer Center. I want them to know that they will be getting the latest and greatest in terms of care and knowledge from me. I'm constantly following the latest literature, going to all the medical conferences, presenting at these conferences, and so I hope that they can develop that same level of trust in me that they would have with the rest of my team. The most rewarding part about being a radiation oncologist, I think, is the longitudinal care with the patients. I get to know them so well during treatment, seeing them every week at a minimum, sometimes every day, and you really get to feel close to them. They almost feel like friends and family by the end of treatment, to the point where when I'm seeing them in follow-up, we're catching up on recent vacations, what our kids have been up to. You really just feel like bonded to your own patients. Radiotherapy has come so far in the last 5 to 10 years, and I often have patients come in with a lot of misconceptions about what radiation is, how it works, what it's going to do to them, and it's a frightening thing to be referred to a radiation oncologist when you have cancer. I think one of the most important things I do is clear up a lot of these misconceptions, tell them how the technology has evolved over the last 5 to 10 years to have better cure rates, less treatments, faster treatments, fewer side effects. And I think when we're done with that initial consult, most patients leave knowing more about radiation and being a lot more comfortable with their decision to move forward with it.